Hi, I'm Robin Meluish from MedReps.com. Today I have Isaac Whatley with me here, and he is a recruiter at Princeton One. So, Isaac, I'll let you introduce yourself and tell me a little bit about what you do at Princeton One.
Thanks so much for having me on here. At Princeton One, I work in our pharmaceutical division. I am the recruitment lead, so I'll oversee a team of our internal recruiters, specifically as it relates to pharmaceutical sales. So I've been with the organization Princeton One about 3 years at this point, and it's been a great experience being able to work with candidates and help connect them with our top clients.
You receive a lot of applications, see a lot of resumes, cover letters. So, what makes candidates stand out to you? What makes you want to give them a call?
As I think of what really does stand out when a candidate will send an email directly to me or connect with me on LinkedIn is when they have a clear objective for themselves as to what they want to see. In a cover letter, I think giving an overview of all the therapeutic areas that you've covered, this is as it would relate to pharmaceutical sales, all of the therapeutic areas that you've covered, the different types of roles that you've held, whether that's inside or outside of sales, if there has been any additional experience within their background in addition to being out in the field. Have they done a home office rotation? Is there any other type of reimbursement experience in there as well that they'd like to highlight? Having all of that in one place, in one paragraph, really is helpful because as recruiters, it gives us context as to what they're capable of, and then ultimately having an end goal, a specific message on what they'd like to see. And, if someone has been in management for most of their career, is that a pathway that they're going to need to stay in order for their career to progress? Or would they be open to other types of opportunities? Or ultimately just stating the objective as to what types of roles they would even be open to. And then, of course, keeping that resume attached as well is going to be very important.
Okay. Well, so once you give them a call, if they've proven that they're a good fit for the role, what can they do during that initial phone screen that makes you want to move forward?
Definitely. As we're working with those in sales, the client is always going to be interested in their sales performance and their sales numbers. And I know that a lot of that is tracked in a lot of different places and may take some time to access. So I think having that information readily available in front of you on the call is going to be really helpful. And in many instances, if you can have that information already pulled from the various places it needs to be pulled from and put together, I'm always impressed when someone will send that experience or it will send those numbers over to me rather prior to our call, as well as being ready to discuss them while we're on the call. I know that's always going to be an important piece that the client is looking for. So I'm always impressed, and it stands out to me when someone's ready to speak in detail to that. I think being ready to have a concise overview of your career is going to be an important piece as well. Oftentimes, on a phone screen, a recruiter will go through someone's resume just to see the different types of transitions that they made throughout the course of their career. So I think having that concise and well prepared, not going into too much detail with each job that they've held, but really just giving an overview is something that can certainly be helpful. And then, of course, just always asking the recruiter back, repeating the question back to them. That's always something that I find to be impressive is when I'll ask a question to a candidate, they'll ask back just to make sure that they're giving me the exact answer that I'm looking for. So that's always something I'd recommend as well.
Okay, that's good in a sales setting, I'd assume as well. So
Right.
it speaks to how they might perform with a customer. So you're talking a lot about experience and numbers. Do you ever hire more entry level positions? And if so, what advice would you have for those candidates trying to break into pharmaceutical careers?
Yeah, absolutely. So many of my clients will be looking for several years of experience. So I particularly at this moment would not be hiring a lot of entry-level pharmaceutical.
Mhm.
But what I will say is that connecting with recruiters on LinkedIn, especially if you see that they're in the pharmaceutical space, is definitely a great starting point. Having a resume, especially if they've come from some sort of background, whether that's B2B sales, really putting together a strong resume that does show those numbers that they've had outside of pharma, as well as just making the connections and continuing to follow up with recruiters once they do gain different experience in other areas, whether that's joining on with a contract company for a while or gaining some exposure that way.
Okay. The flip side of that question, I guess, is, can you have too much experience? You mentioned having a lot of management positions. If you see that on a resume, does that automatically make you think, oh, they're not right for this field position? Or, how can you overcome that, I suppose?
Gotcha. I think having a strong resume is always going to be the starting point across the board. Being able to lay out and articulate the different positions that have been held. So if someone's been with one company for quite a while, being able to pull out the different pieces that they've learned throughout the course of that time. So, and going back to the cover letter piece, I think really just sharing their open, transparent interest. If someone has been in management for a while and they would like to go back to an individual contributor type of role, if that's something that they would honestly like to do, just having a transparent conversation as to why they would like to do that. And I think just being just completely transparent and candid with a recruiter is how they're going to be able to make the best connection for that candidate.
If someone doesn't have experience with pharma or with a specific product, or how could they position themselves as a strong candidate?
Yeah, absolutely. I think if someone does not have a specific therapeutic experience and they'd like to break into that, I think the best way to prove that they're going to be able to do that is to show examples of in the past where they have taken on new responsibilities, where they have broken in to new therapeutic areas. And I think once again, going back to honing in on a well-crafted resume, even blatantly putting a note to the recruiter, or whether that's in a cover letter or on the resume, that this was their first time working in that therapeutic area. This was their first time taking on that experience. And then going back to the numbers piece as well, showing this was my first experience, these were my numbers with it. I think pairing those together can certainly prove that someone is able and willing to break into something new with success.
Well, what questions have I missed? What other advice? What's the most important thing you think candidates should know right now who are searching for pharmaceutical sales jobs?
Absolutely. As a general rule of thumb that I will always recommend to any candidate is, as I mentioned back to the performance piece, it's a sales world, so that's always going to be an important piece that the client is curious about. And I know that there's a lot of moving pieces sometimes when it comes to accessing those numbers. So I would say having a regular check on where things are at, always having the most up-to-date information to share with the recruiter, having that readily available is going to be a big piece. Another piece with that is having a resume that's always readily available. Even if someone is completely satisfied in their current job, they never know when something might pique their interest. They never know if a call from a recruiter might be just what they're looking for. They never know if a new posting on a job board might be exactly what they're looking for. So keeping an updated resume gives someone the freedom to immediately at least express more interest. A resume is always going to be the starting point with any recruiter or any job board.
Mm-hmm.
So if someone has not updated their resume with, let's say they've been at a company for a while and haven't updated it in 2 or 3 years, if they see something that they like or is exciting, they're going to have to go back and update that. And that can take a lot of time. A lot of things happen within 2 or 3 years. So you might even forget different elements to highlight on your resume. So my recommendation is once per month, no matter what has changed in someone's job, once per month, go back, take a look at your resume, evaluate it. Is there anything that can be added, anything that can be changed? And I would recommend keeping access to that updated resume on your phone, whether that's using Google Drive or storing the file on your phone as well. That way, at any moment, whether a recruiter has an exciting opportunity that they're moving quickly on, or they see a job posting that really piques their interest, they can be ready and updated and know that the resume is always going to be available to send over.
Well, I just can't thank you enough for taking the time to talk to me today and giving some great advice to our MedRep community.
Of course. Thank you very much.